and welcome to Affected, a podcast from Meet. For those of you who don't know Meet, we are a global life sciences talent provider. We've been connecting the industry for over a decade, and now we want to share some of our insights and experiences with you. We'll be hosting monthly episodes, sharing thoughts from our leaders and industry professionals about job hunting and hiring in life sciences, as well as giving our network a platform to share their own experiences of building successful careers in an industry that affects us all.
Hi, and welcome to another episode of the Affected podcast. This is number 15 now, which is crazy to think about. We've been going nearly 2 years.
Oh my gosh.
Which is really wild to think about.
That's a long time.
Yeah. Today, I'm joined by our content writer, not Glenn. Doesn't pay my bills, unfortunately. I think he wouldn't pay me too much either, to be fair. Rosie.
Yeah.
And today, we're also joined by someone from inside the house at Meet. We're joined by Ted, who's basically come in and set up our pathology market within the company. It's not a market that we've really worked before. I think that's fair to say. And this was a great opportunity to sort of sit down and maybe not just for our viewers and listeners, but also for some of the guys in the office to kind of actually learn what pathology is. And
I do talk about it quite a lot when I'm in there, but it would be good for everyone to sort of realise, because I know I didn't know what it was before I got into this.
So I guess the first question is, what is pathology? I think, like a lot of us during 2020, during COVID, we were hearing an awful lot about vaccines being built and stuff like that. We probably heard the word pathogen and pathology kicked around more than ever before. So what in sort of like a layman's term, what is pathology?
Yeah. So pathologists diagnose inflammation, disease and infection. Now, nearly all cases of cancer are diagnosed by a pathologist at some point. So really, they're the unsung heroes, because if a patient goes to the doctors and then a few weeks pass and they come back and they find out the unfortunate news, no one really thinks about how they came to that conclusion. And it is the pathologist who gets them there.
I suppose to get a better understanding of what a pathologist actually does is to sort of to hear an example of it. So, for example, if I'm a patient and I go into the GP, what are the steps that happen between sort of me getting a test done at the GP to those results coming back from wherever they come from?
Yeah. So let's view it like this. So say patient X goes to the doctor, they have something on their skin they're not sure about. The doctor says, right, we're going to run some tests. They take a tissue sample. That sample is then sent to the Institute of Pathology. Before the pathologists can really look at what they're dealing with, it has to be prepared. Now, I'm not going to go into really specifics for you, but it has to be fixed. So fixation, this involves chemicals being added, and that just stops all degradation. I mean, the sample could be like that big. It would be very small to the eye. Anyway, once it's fixed, it has to be dehydrated, normally with alcohol, so ethanol is applied, and then it's put into a paraffin or a plastic, and this kind of makes the whole thing solid, and it allows the cutting to be done.
Mm-hmm. Is it the pathologist that's doing all of this themselves?
It differs by country, not all of this. So this would be histotechnologists, or in Germany, MTLs, MTLAs, the support staff of the institute, but without them it wouldn't work. Often it's called cut-up. Some pathologists will do it, some pathologists won't do it. It really differs by country and what they have to do and what they don't have to do. So it's embedded into this paraffin, this plastic. It's like wax almost. Mm-hmm. And then it's taken for sectioning, and it's sliced incredibly thin. If you looked at it side on, you couldn't see it, how thin it is. And it wouldn't be possible to do by hand unless you're really, really skilled. I don't think it would be at all. Once it's then sliced, those will become the slides at some point. But even still, you can't really see what you're looking at. So it needs to be stained. So they'll apply chemicals to it. They can really see the components inside when they're looking down the microscope. So all the nuclei, etc. I'm definitely not going to go any more technical now. And I do have it written down here. But it then becomes fixed into the slide. Once it's fixed, it'll be ready to view. So that'll be one of the ways that a pathologist will have that prepared for them. Now, you can have something called frozen section. This is really interesting. I've seen this be done. This happened on my first or second ever meeting with a pathologist, and it blew my mind. So frozen section is where someone is having a surgery or an operation, and they find something they maybe didn't expect, but they did expect it, and they have a limited amount of time. They need to work out what what it is and what to do with it. So some will be in surgery. Obviously, they're probably out at that time. And then a small sample will be taken, maybe a biopsy of whatever that needs to be checked out. That will be sent on ice to the pathology and frozen really quickly to something like -30 or -40 degrees. When it's this cold, you can cut up effectively, so you don't need to go through all the processes before. But this whole time, the patient is still under. So
this is happening in real time?
This is happening in real time. So the pathologist will be on the phone, often on the phone. They'll be back and forth, and they'll be analysing the slides under the microscope as the patient is having the operation. And depending on a lot of factors, but they could look at what it is for starters. They'll tell them where it starts and where it stops, because you have to be really careful when cutting out a tumour. You don't get anything which isn't necessarily bad and doesn't necessarily need to come out. So they'll be able to look through the slides and say yes or no, basically. This needs to go out, this can stay in for now. Once that's done, and this is all done over the phone, as I say, it could be 20 minutes, 30 minutes, because there's a very limited amount of time where it has to be kept cool enough to travel. One of the most experienced pathologists I've ever witnessed was the person who did this on the second or third meeting I had. And it was incredible. I watched her over the microscope. It took her maybe 10 minutes in total to analyse it. And she was able to give the diagnosis and give her advice to the surgeon about what to do. But that isn't...
Wow.
Yeah, it's incredible.
I'd watch a TV show about that. Like that should...
Yeah, you probably have. I mean, honestly, you will have done. This is why they're always saying, get this to pathology.
Yeah.
Or get pathology on the phone. Obviously, it doesn't go down like that. But in Hollywood, maybe it does. So yeah, that's one of the things that they'll do.
So they're mostly involved with the diagnosis?
They're just a diagnosis, pretty much, yeah. I mean, you do get some pathologists who aren't doing diagnostics, not to really overcomplicate it.
Yeah.
A lot of the time, we mentioned digital pathology, a lot of the time pathologists can do consulting roles, so able to improve the technology, work in medical devices. That's something a little bit different. And those roles are really sought after. There's not many of them, but they are out there for sure.
Are they quite hands-on with the patients themselves? Like, do they deliver the news?
No.
No, so they're sort of in the lab.
Normally, they will just receive patient details, so the age, the gender, the history, and the cases, and the slides in the cases. So a lot of the time, they're just a number. You don't get a name, no connection. Yeah.
Wow.
And I think that's important. So I think that's important when you look at the types of pathology out there, because if you're emotionally connected to it, it must be really difficult. I mean, it's not a fun topic to talk about, but I know a pathologist who's specialised in fetal pathology.
Yeah.
So they're an academic. So this is more research-based. You don't get fetal pathologists in private institutes. But you do get some paedopathologists who basically work with children who have cancer. So I do think it's important that they're not patient-facing a lot of the time, because
taking that home with you is
yeah.
So it's pretty safe to say that at some point in all of our lives, a pathology will have played a role in in our healthcare.
Individually, yes. Even if it's not directly through you, everyone we know has probably had some sort of test at the very least. Personally, I didn't even know what pathology was until a year ago. If you can't tell, I love it now. I don't have 12 extra years to become one, unfortunately, so this is the closest I can get.
Were you a science man at school?
No, it was awful. It was absolutely awful. I was predicted a D in biology, but I did get an A.
Well, there you go.
Yeah.
Proving everyone wrong, man.
Yeah. Absolutely.
And is it sort of like what educational pathway does it take for someone to get to that point? Is it a MD? Is it sort of PhD?
It's a long process.
Yeah.
So obviously it's different in all countries. Everywhere does it a little bit differently. So I actually recruit pathologists across the DACH region. So Austria, Germany and Switzerland, predominantly Germany and Switzerland at the moment. And they have similar systems, but even still, it's not exactly the same. And I'll go into that in a second. But it takes a long time. Minimum is 11 or 12 years.
Oh, wow.
Yeah. So in Germany, you have to become a doctor, which takes 6 years, I believe. And then after that, you have to specialise in pathology, which is a minimum of 6 years on top of that. So really, you're not fully qualified as a professional at the earliest until 28, 29, 30.
Does that put people off from pursuing that career?
I think if you're going to become a specialist doctor, you're committed to that sort of time frame anyway, because outside of pathology, there are so many other fields you could go into. But people are put off by pathology, or even they're not encouraged to enter the world of pathology as much as other fields, 100%. And obviously I'm happy to get into that as well. But yeah, it takes a long, long time to be there and a lot of hard work.
Gosh, yeah, 11, 12 years.
Yeah, crazy.
It's a long time, isn't it? Sort of like overtaking architecture.
Yeah. I have to vicariously live through my candidates and my clients because I just don't have that level of commitment. Also, there's no guarantee that it takes 6 years to do the specialism.
Yeah.
So, I mean, in Germany, I don't want to under-explain it or get anything wrong because I'm not a pathologist. But in Germany, not only do you have to learn about all of the organs and all of the training to do with the actual pathology itself, but alongside diagnosing living patients, some pathologists do autopsies. So in Germany, you have to complete 150 autopsies. Oh, I hit the mic. You have to complete 150 autopsies before you can officially finish your residency, which is that training period, before you become a Facharzt or a specialist. Now, it gets a little bit technical because they have different names, but generally I recruit histopathologists and cytopathologists. Histopathologist is all about tissue, cytopathologist is all about on a cellular level, and they're very different. But you also get forensic pathologists. Now, in some countries, forensic pathologists are the people just doing the autopsies, but in the UK and in parts of Germany, you have a forensic pathologist who just does the autopsies, but in the UK, a forensic pathologist could also do normal histopathology diagnostics as well. It really differs country by country, but people do get quite particular about being called a certain type of pathologist if they're not one, obviously.
Yeah, I mean, that makes sense, right?
Yeah.
So you mentioned you work primarily in that DACH region. Could you give us a bit of an overview on sort of what the market in that region looks like at the moment, sort of, what the demand and the supply of pathologists are?
So my understanding is they are one of, if not the least common doctor in all of Europe. That applies to Germany. I've heard the situation is a little bit worse in Poland and other countries, but Germany has it particularly bad, and has done for the last few years. Essentially, to my knowledge, there are currently 800 roughly qualified pathologists, 1,500 when you include the residents or the trainees. But, I mean, Germany has an ageing population anyway, really ageing.
The statistic which actually blew my mind is by 2020, 1 in 3 Germans will be over the age of 60.
Yeah.
Which is crazy.
I recently had it quoted to me, and I do believe this, I think I've seen it in a paper somewhere, more than half of the pathologists in Germany are over the age of 60.
Wow.
Themselves.
Half?
More than half. Yeah.
How long do they normally work for until they retire?
Often until they retire, but you do get some pathologists who will do locum work or like part-time stuff, maybe for a few hours a week, maybe a day or two a week. I mean, if they've done it their whole lives and they got into it because it is their passion, it makes a lot of sense.
So are they working past 70 or?
Sometimes, yeah.
Wow.
I think the oldest pathologist I've spoken to is in their early 80s.
Wow.
Yeah.
Wow.
Yeah. Still going strong.
And that's just a passion. It sounds incredible, but it's a passion thing, right? They just love what they do.
Absolutely. And I think a lot of them as well. I mean, to do this, you have to have some sense of moral responsibility, I think, and feel like they have a higher purpose, which they definitely do. But I do think some of them feel obliged to, because if they didn't do that work, the system would be in an even trickier situation. Essentially, you've got an ageing population in Germany already. You've got a very finite and few pathologists, a very low number of pathologists. But you also don't have many doctors taking up pathology as a specialism.
Right.
So more and more cases every year because the population is aging. So there are more people getting checked out, and then there are more cases to deal with. You've got less pathologists starting every year, and because of the ageing population within pathology itself, you've got more people leaving the field as well. So really, a case number is increasing and the number of people who can deal with those cases is
Okay.
decreasing.
Yeah.
Big time.
So how do you think you tackle that kind of recruitment retention for pathologists in Germany?
How do you mean? How do you tackle the problem?
Yeah.
Obviously I'm only so limited in what I can achieve.
Yeah.
And there are massive regulations, a large number of regulations in Germany, in every country, as there should be. I have 2 or 3 ways I think this problem will be solved, but it's not something which can be brushed under the carpet, right? That's got to be clear. Like, this will come up and rear its head at some point, and it already is. It's just not being talked about.
Yeah.
So the first thing I try and encourage is specialisation. So in Germany, it's very popular to be a generalist, which is okay. It means you can do everything. And if you look at geographically, so city by city, there could be a large number of institutes. This is where the diagnostics are done, where the pathologists are based. But if you have a large area of countryside, a massive region, you may only have one institute of pathology there. The pathologist, or the 2 or 3 pathologists who are there, have to deal with a lot of different type of cases, so they have to be generalists, I find, anyway. Whereas if you are in a city, you can get some more specialist pathologists.
Yeah.
The makeup is really important as well. Just to mention, before I answer your question, I will answer it. You get university hospitals, you get public hospitals, and you get private institutes. University hospitals deal generally with a very wide array of cases. These are the pathologists who love academia, perhaps. They do a lot of research, some teaching, but they deal with some really complex cases, some very rare types of cancer. And a lot of them are doing research to further the diagnostics.
Right.
In public hospitals, they again deal with everything. And in private institutes, you tend to find a narrower spectrum of cases. This, I believe, is because the most common types of cases, so gastrointestinal pathology and dermato, for example, as well, are the simplest normally, and there are more of them. As a result, they can be more financially viable,
Yeah.
whereas it isn't justifiable to have an institute specialise in a very rare type of case, because they just don't see them that often. And even if they pay really well for that one case, there aren't multiple coming in per day. Exactly.
For a while,
exactly.
Right? Yeah.
But yeah, to answer your question, I like it when pathologists specialise and move to an institute where they can be used best. So it's very difficult, because if you think about the age at which they become qualified, most people by that point, if they are going to have a family, will just be starting out. So 28 to 32 is really the age you can become a specialist or a Facharzt, and that is the age most people tend to have children. So relocation is very difficult. So it can be hard, but I do like it when they specialise. I like it when they're surrounded by other specialists, and it just means that cases are dealt with more efficiently. And I think if you move people around successfully, it will alleviate some of the strain. So you do have some institutes under massive pressure dealing with too many cases, and it is too many. I mean, if you compare country, Germany, some pathologists will deal with 60, 70, 80 cases a day, which is a very large amount.
Yeah.
Whereas in Switzerland, as a rule of thumb, no one is dealing really with more than 40, and definitely not more than 50 cases a day.
Okay.
So the disparities are massive. My point being, if you have people in places where there's less strain, they're not being put to use as well. Whereas if you have someone who's a generalist in one of those areas, they could be better put to use in an institute which receives more cases. So that's the first thing I'd do. The second thing I would do to improve the system is open up regulation, or deregulate, open up doors to international pathologists a little bit more. Now, this is very difficult, because you do need to have C1 German to become qualified, which is completely understandable.
Yeah.
I would maybe sway this more towards medical language rather than everyday language. But again, I appreciate it's a very difficult topic to discuss. But I'll give you an example. I know a pathologist who is an international pathologist. They studied for 12 years outside of Germany. They were qualified in a country outside of the EU. They moved across. They failed the language exam because they didn't know the difference between a wasp and a bee.
Right.
Now, you could look at that in a few ways. You could argue, I mean, look, they were 1 mark off failing anyway, clearly. and I have no idea what their medical language ability was like. But you've got this highly skilled individual who's come to Germany and could solve some of the problem, but they're not able to because of regulation. Another example I can give is with the Russia-Ukraine war is really sad. The number of skilled pathologists, both Russian and Ukrainian, who were displaced and moved to Germany, but didn't have the German language skills to become a pathologist, and I understand they can't do that.
Yeah, yeah.
But to even be a technician in some of these institutes, you need BT level German. They don't have that. So you've got these highly skilled people who just can't work. Again, it's probably a topic for another day entirely.
Yeah, for sure.
But yeah, language and opening up doors to international pathologists, I would definitely focus on that, because that would solve the problem very quickly. Also, you've got to consider, if you're an international pathologist and you're outside of the EU in particular, often the quality of medicine and the quality of work can be brought into question because it's not up to the German standard. And I agree, sometimes it definitely is not up to the German standard at all. But you can have people with 12, 13 years experience come to Germany and then they wait a year and a half to even get their papers back, to get the approbation. And then they have to be a resident again, a trainee again for another 2 or 3 years before they can even practice. So there's no motivation for them to come to Germany if they understand that. And the number of doctors I speak to who don't understand that before they get to Germany is quite scary. And then the third solution, which I think is probably the most likely, particularly the way the world is going, is digitalisation. So digital pathology. It's fantastic, I believe. Some people are not so sure, and I completely get the arguments. Essentially, it means you don't need the microscope anymore. So really, really high definition, high-tech cameras will take images of the slides, which you would normally use under a microscope, and then they can be transferred digitally, and you can have a really good monitor in front of you. You can zoom in, and it actually reduces neck problems in pathologists.
Yeah. Something you don't even
consider. Don't even think
Yeah.
about. But it can be harder with complex cases.
Right.
And it's maybe less reliable, those complex cases. Now, there are some pathologists who would argue that and say it's fantastic, but there would be others who would say, I don't trust it. But alongside digital pathology, the reason digital pathology would help the solution is because it allows pathologists to work from home. So it makes it far more attractive, so the commuting times are reduced. Also, you can just jump online, jump on a Zoom, confer.
Yeah.
But again, that's kind of a debate in itself, because is that as effective as when you're in person in the institute being able to do that? And then the other argument you could say is open up internationally and let people report across borders, which is a very difficult conversation to have. And the problem with that isn't actually the technology, it's the data, the security going across borders.
Right.
So that's why that hasn't happened yet. It happens in parts of Europe, but Germany is very far off that. But yeah, digitalisation is probably the way forward, I think.
It's really interesting, isn't it? It feels like when we speak to a lot of people in sort of like the life sciences field, and that digitalisation of medicine, digitalisation of healthcare is growing at a rapid rate, to the point where we've probably seen the quickest uptake and quickest sort of like evolution that we've ever seen in the history of healthcare.
Oh, it's amazing. I mean, pathology is really old. People don't realise how old pathology is, hundreds of years old. But the progress that's been made in the last 30, 40 years, probably the last 20 years actually, compared to the progress prior to that, is out of this world. New techniques, new methods, new technology, obviously digital pathology, as I mentioned, but it doesn't just stop there.
Yeah.
And as the technology keeps on increasing, it will become more efficient, and it will be easier to deal with more diagnostics at one point in time. I mean, they're even integrating AI into diagnostics now. Yeah. Essentially, AI is being used to spot biomarkers. Biomarkers are indicators in a slide which tell you that it could be this diagnostic or a diagnosis, or it could be that diagnosis. And AI is going to do that job for the pathologist. But again, it's not watertight, it's not 100% perfect. And you kind of have that question, do you really trust a computer to do that for you? I mean, even though human error is more common than an AI error, I'm led to believe, I don't know if I do. I mean, I wouldn't let a robot cut my hair.
Right.
So,
and it's that whole. We were speaking to someone last month who's sort of integrating AI into learning and development within sort of training medical staff to work on or understand when there are issues with pacemakers.
yeah.
And it's sort of like, well, if you put really good information in, you're going to get great information out. But if you put garbage in, that's what you get out. And it's sort of like trying to find that balance. AI is both the most exciting thing and most terrifying thing I think I've ever come across.
You know, I get pathologists. It is really split. So, funny enough, the younger pathologists tend to be really excited about it. So, I actually I placed a pathologist fairly recently who wanted to do an AI course alongside their studies. So they weren't quite qualified just yet, and they were able to do that, and that was fantastic. That was one of the biggest reasons for them to change, because they were offered that.
Yeah.
But I spoke with a dermatopathologist who specialises in skin dermato, really experienced, and he's actually retraining or trying to get re-qualified as a dermatologist because he doesn't think his job will be there in 10 years' time.
Wow.
Because of AI. So it's very differing views. Whether jobs would be lost over it, I don't think so, because I mean there are so many vacancies right now. It probably wouldn't do the world any bad if there were less of them.
I think we have this conversation an awful lot, and it's sort of like AI is a tool. I think we always have to remind ourselves that AI is a tool that we can use to make our lives easier in the jobs that we're doing. But that is a different conversation for. We could sit here and talk about that.
Yeah, for sure. And
itself.
I think a lot of the time I mean, I don't know how it's used properly, but I imagine AI does the legwork and the pathologist will take a look, and because most of the processes have been completed already, they can give an overriding yes or no answer. But as I say, it's definitely not watertight, particularly with complex cases where you're having to look at multiple different structures under a microscope at one point in time, on the monitor, because it'll be digital.
So what are some of the trends that you're seeing? Obviously, you're very tied into the market. You are essentially our pathology market expert at Meet Life Sciences. So what are some of the things that you're seeing? Some of the trends that are happening at this point in time?
Yeah, so obviously we've spoken about ageing population, we've spoken about digital pathology. Let me talk to you about what people want, what pathologists want right now. So as I said, most of them are very settled, and they all earn good money, all relatively. So it kind of comes into question, where is the motivation for them to leave? The things which pull pathologists in, interesting caseloads, they've got to be interested in their work, of course. Obviously, financial motivations. But outside of that, leadership can be really important, and other factors not even involved with pathology. So some of the trends I see, a lot of German pathologists or pathologists in Germany, they've always enjoyed going to Switzerland and moving to Switzerland for sure. But I mean, I'm actually writing an article at the moment. The movement of pathologists in Germany to Switzerland is not only increasing, but it's about to go through the roof.
Oh, really?
Yeah, and it's really going to affect both markets. I think the Swiss will benefit, of course, because they're gaining more pathologists, and there is a shortage in Switzerland as well, but it will really damage Germany.
From what you were saying, they're being sort of like a talent deficit already. So I mean, look, there's a few things to break down, right? So Swiss salaries are much higher than German salaries. Now, cost of living is a lot higher as well. So it's always been an attractive destination for pathologists to go. It's warm, it's beautiful, and it is a different way of life.
I'm going there on Tuesday.
Are you?
Yeah, I've been to Switzerland.
Have you ever been before?
No.
Well, tell me how it is.
Yeah.
Where are you going?
Interlaken, like in between the lakes.
Lucerne? Laken? Lucerne? We'll cut this, but...
Yeah, we will not do this. It's like near Bern, which is the capital, and then like below they have like a few lakes. There's a place that's like in between the two lakes called Interlaken, which is
lovely.
In between.
Oh, wonderful.
But yeah, it's just like classic, like blue lakes, green hills.
Yeah, absolutely.
It should be really nice.
Well, I mean, a lot of Germans like skiing as well, so that you can ski there. You get lovely weather, and the cities themselves are really clean, really beautiful. So yeah, it's a really, really attractive place to look at, Also, you can earn a lot of money there, as I said. And the pathology there is a little bit different too. Yeah. So, I mean, we talked a little bit about caseload. Whilst Switzerland needs pathologists and has a high caseload, is nothing compared to Germany. I mentioned earlier, some German pathologists will be doing 60, 70, 80 cases a day. When it really comes into question like the working conditions they're under them, because that must be really long days. Whereas in Switzerland, you don't really see anyone doing more than 50 as an absolute maximum. Typically, it's between 20, 30, and then a pathologist who deals with a lot of cases in Switzerland will be averaging around 40 at most, really, and then occasionally a little bit higher than that. I think
so it's like half.
Yeah.
Yeah, that's a lot less.
Yeah, for sure. I mean, look, it's always been attractive, and often I talk to pathologists and it's in the back of their mind. Oh, I've always wanted to go to Switzerland. I wonder what Switzerland's like. Switzerland could be really good, or the salary, etc. Beautiful country. We've already spoken about the benefits. As of 2024, I think, Switzerland, or 2023, Switzerland's population has been something like 8.8 million. Germany's is 80-something million. So Switzerland is just over 10% the size of Germany population-wise. There's only so many pathologist positions. Now, the makeup is very different there as well. So we have a trend. There are 3 or 4 massive diagnostic groups who buy multiple institutes of pathology, and then there are very few independent institutes left, a handful at most, maybe even 2. Whereas in Germany, as I mentioned earlier, you have private institutes dotted around. There are some groups which own multiple locations, but you could have one boutique private institute in a location which services X number of hospitals. Then you've obviously got the university hospitals as well. In Switzerland, you have massive institutes, sometimes up to 20, 25 pathologists, and you have the odd independent institute with 3 or 4, maybe 5 pathologists. So it's a different makeup. There are less vacancies, and Germans have always wanted to move across, or German pathologists or pathologists in Germany have always found it attractive. But the 2 factors which essentially are going to result in these vacancies disappearing in the next 2, maybe 3 years at most, I think. Number 1, because Switzerland is very Swiss-centric and they like to keep things inside of Switzerland, which is completely fair enough. In the past, to be an international pathologist working in Switzerland, you have to work in a public hospital for 3 years, and then your license is valid for you to go and work in a private institute, where naturally you can earn more money. This is changing, so it's all state-based. So unlike Germany, where if you're generally qualified to work in a state, you can work in all of them. It's a little bit different for international pathologists. In Switzerland, you have a state license, a canton license. Now, each canton is different, but some of them have started to lower the barriers and allow international pathologists to work at private institutes straight away through certain loopholes, etc. The problem is, and the reason this has happened, is because pathology is so different to other medical fields, and I mean, we've spoken about the lack of them. It's a very interesting and specific case or scenario, which is why they've had to lower these barriers. You combine that with what's going on in Germany at the moment politically. Now, I'm not going to comment on anything political at all, but with the rise of the AfD, you are, fact, going to have pathologists and people who don't want to be in Germany anymore and disagree with it politically. So where are they going to go? If you've always thought about going to Switzerland, in a German-speaking country where you're going to be opened with welcome arms to a private institute where you couldn't go to before, you're going to go to Switzerland, or you're going to consider it. When more pathologists start to realise this, those vacancies are going to be filled and filled and filled, and it won't just be the older pathologists, it will be younger pathologists who have young families who want to start a life and build something in Switzerland. So not only will Germany lose pathologists, it's likely going to lose the younger ones.
Which is the section of people you can't lose right now.
Exactly. So obviously Switzerland will benefit greatly, and Germany, well, I think they'll really suffer. But saying that, there's no guarantee it's going to carry on this way. I believe the cantons are going to continue to lower their barriers for sure. I don't know what's going to go on politically, but there is definitely some unrest. I mean, particularly when I talk to these people every day. In Germany, I can't see them opening their doors to international pathologists, like we spoke about earlier, which I understand a point of view regarding that. I do think it's probably the best answer, but I understand their position, or not even their active position, but I just can't see it happening. I think digitalisation will change everything and will have to be the saving factor for Germany. It's when it comes. So digitally, they're a little bit, not behind, but there are other countries in Europe who have opened digitalisation, have accepted digitalisation with open arms. And as a result, processes, structures, digital networks have been allowed to blossom and really grow. And people are really starting to see what you can achieve across borders, but particularly on a national level. So, I mean, the UK is so much more digitalised than Germany is. But it's by no means perfect, and I think UK pathologists would tell you that as well.
Yeah.
But yeah, digitalisation is probably the answer.
So I guess this leads me on to our sort of like final talking point. And this is something that I always like to do at the end of these episodes, and that's to sort of like offer some advice to the people who are listening to this. And I guess we can look at it from two aspects here. I think we'll start with the pathologists themselves.
Yeah.
If I'm a pathologist coming to you, maybe looking or wanting to go to Switzerland, or just looking for your help in general to obtain a new role, what would your sort of main pieces of advice be to me?
Well, the first thing I would say is, look, I have not put in the years of work that you have done. By no means do I have any of the technical knowledge that you do. However, I do understand the way certain institutes work, and I understand the market. And by that, I mean, pathologists don't really like moving. They don't like talking about changing. And because they're so rare and they're so sought after, a lot of pathologists fear that bridges will be burned if they leave. And it feels like betrayal, because if they leave, it can take years to find a replacement. But often these institutes don't have years.
Yeah.
So guilt is one thing I see quite a lot. I would say there's nothing wrong with having a conversation and finding out what's out there. The other thing I would say is you're never going to know unless you find out. A lot of pathologists, I think, fall into the trap of thinking, I earn a good salary, which they do. And if you don't aspire for more in each of these factors, that's absolutely fine. But a lot of them fall into the trap of thinking, I have a good salary, I don't have to work weekends, whereas a lot of doctors do. There's no shift work. Because they're not patient-facing, they're not really in the hospital. Sometimes they are. They're not really in the hospital. And as a result, they sort of not limit themselves, but they're not open to looking at new opportunities.
Well, they feel like they don't need to.
Exactly, right. They feel like they don't need to.
Yeah.
And if you feel like you don't need to and you're content, that's absolutely fine. But if there is any part of you which thinks, I'd love to deal with some more interesting cases, or I'd love to do this, or I'd love to learn, or I'd love to pick up another board certification, or another subspecialty, there's always somewhere where you can.
Yeah.
And I think it would really surprise you to have a look. One of the other pieces of advice I'd give is be prepared for change, because things are about to change. I spoke with a director at a hospital recently, and we were talking about a lot of smaller hospitals not having any money, or being in financial troubles in Germany compared to the past. And they put it really, I mean, it seems so obvious afterwards. He said to me, the politicians don't want to be the ones to close a hospital, because that never looks good. But they're comfortable allowing a hospital to close on their own.
Yeah.
As a result, with financial struggles, you're not going to get many institutes being able to improve and get better. So yeah, I would just be prepared for a lot of change. I think you're going to see these mega institutes forms where multiple companies come together because they have to. And I think there's going to be more focus on university institutes where they're already large established hospitals anyway. But yeah, my advice would be keep an open mind and explore all the avenues in front of you. And don't feel limited because of what other people may think.
Yeah. Ultimately, you're the person who is living your life.
Yeah.
And you know, you got to essentially do what's best for you and your family.
For sure, right? For sure. And it may not be a move. It may not be a change.
Yeah.
Like, you can't force anyone into change. They have to realise it themselves. But but you're never going to know what the best thing is if you don't have a look.
100%. I guess then, speaking to institutions, which can be a tricky thing, full stop, but what would you say to them to sort of maybe kind of get a brighter horizon in terms of the world of pathology?
Well, I think institute's biggest problem is not having pathologists. I think the way you're going to get more pathologists, whether you like it or not, is digitalisation and allowing people to work from home office. That home office is one of the biggest buzzwords I hear every day. It's actually more valued than salary.
Yeah.
I've seen pathologists willing to take massive cuts in their salary just because they can start working from home for a day or two. And it's like what we mentioned before about having young families, getting to that age. It makes sense. And if you are in an area in Germany where you have a young family, you don't want to move because your kids are going to school and they've got friends, but there aren't loads of institutes nearby, so it does kind of feel like you're limited. Digital and allowing home office just opens it up. So yeah, my biggest advice would be encourage digital pathology.
Amazing. And I do have one final thing I want to ask you, and this is recruitment based.
Yeah.
I think Ted is a very special case in terms of sort of how a recruiter goes about their day-to-day activity. One of the things that sort of took me back is you approached me about this podcast, where I'm usually one being like, hey, like let's get you on this podcast right now, and sort of, you know, you spoke to Rosie about writing your article, which we're all very excited about coming out over the coming week. How important do you think it is to sort of like be interested and clued in to the market that you're working in, to understand those trends?
Very, for sure. I think when you can talk confidently about something, not only does it come across more impressive, and by no means am I saying I know a lot about pathology, because I don't.
But you know a lot about the market.
Yeah, for sure.
Yeah.
For sure. Knowing a lot about the market, understanding their problems is massive as well. But yeah, I think you've got to have some passion for what you're doing. I would love to be a pathologist. I've always loved detectives and investigations. I think the ability to look at something like that, which is complete, it's like another language to people like you and I, and be able to say, no, it's this, this, and this, and about something that's so important as well. I mean, I actually, in my prep for this, I wish I'd have said it earlier. The number of cases of cancer is increasing, but the mortality rate is actually decreasing. This is very small percentages, and this is across Europe. Basically, just because people are being diagnosed more doesn't necessarily make it a bad thing. You want that. Whilst you don't 100%. Want there to be more cases of cancer, you want there to be more diagnosis of it, because if you catch it earlier, there's much more chance of it being treated.
Yeah. That's fair. And you did get your A in biology, so all it's going to
take... I did get my A in biology.
All it's going to take is 12 years.
I did.
And,
yeah.
Maybe we could...
Please don't fact check me as well, because it was a double science. Science. Listen, so it was like a split A.
I did a film degree, okay? So listen, all I can say is thank you so much for taking the time out of your busy schedule. I know you guys... You value your time so highly on the phones in the office, so thank you so much for being here. And I have a feeling this might not be the last time we see you.
I hope not. It's been a real pleasure. I'd love to get someone who actually knows what they're talking about next to me as well, a proper pathologist, a real pathologist. I'm not a pathologist, but yeah, it's been a real pleasure. I could talk about what I do all day long. I absolutely love it. Yeah, thank you very much for having me.
I think what I would say now is if you're in the field and you want to have some of those conversations, listen, a conversation costs nothing, it doesn't lock you in, it's not a contract. Reach out to Ted. You know,
it doesn't even have to be about a job.
Just to say hi.
Just to say hi. No, seriously, I talk about the future. Even recently, I had a conversation with someone who wanted to go into a certain field or part of pathology, and I didn't work with any of the institutes that would have suited them, just because they weren't really in my area. But I said, look, I don't think a private institute suits you. I think the things you want to achieve, you've got to go to university. I don't work with those universities, but I know they can offer this. I know their technology is fantastic. If I were you, I'd apply there. So it really isn't just about what job. I just love talking about the subject and the market.
I think we can tell that.
Yeah.
It's clear.
Yeah, don't worry, I'll stop now.
All I've got to say is thank you so much, Ted. Thank you so much, Rosie. How was your first time on the podcast?
Yeah, it was great.
Is this your first time?
So much. Yeah, it's my first
I
time.
love that.
Yeah, great first speaker, I must say.
You've normally got Glenn over there just dominating the conversation. I can't ever get a word in sideways when he's here. It's
get me back.
It's been refreshing for you.
Thank you so much, guys. Please join us next month for another episode of Affected. We've got some fantastic guests lined up. I'm really, really excited for this season 2 of what we're doing here. And see you next time. Bye.
Thanks.